I was born quite a long time. I was 10 when the NHS started. So when I started with asthma. I've had health problems all my life, really. Well, when I was 13, I started. I had whooping cough when I was young, and that was very bad. And then I started with asthma when I was 13. And I've had other health problems, but when I started work, people wanted to, went in the mill at that time, and I wanted to do, but I couldn't because of my chest. So for a while, I just worked in a sewing factory. And then when I had my children, I wanted to go into nursing, but I got other health problems by this time. So I suffered from lupus disease, which affects, all different things. So my blood, I had blood disorder. So I failed my medical. I passed all the exams for nursing. So because I wanted to do something like that, I applied to social services for home care. So I worked in, I've experienced the NHS when it was in its glory, at its very best, because the home care service, I started there in 1974, and it had just become a really good service. They dealt with everything, health and social care. They even had a consultant to come out to patients in their own homes. Even though there was still outside toilets, most of our clients had outside toilets and coal fires then. They had to have a commode, and even they had to have they called it a muck cart, because they came round once a week, the council, and changed the commodes, took them all away and give them a new one every week. But everything, nobody suffered, everything were like the best quality care you could have. And we trained at Moston College, and they did role play and everything. Like you had to pretend you were blind. We had to put a blindfold on and somebody leading you, so you'd experience like what these people were going through and everything. Anyway, it worked. It were a really good service, and till later on, I had to finish work then in 1991 because of my health. It became chronic, my condition, and I was, really bad. So I finished work then, because I had to do. I didn't want to do, but I really had to do. But for a while I just felt pretty worthless, because I'd always lived an active life working with people, because I loved the job, in social care, because we did everything, really for the people. We had about 9 clients each, and we could, we worked on our own initiative, really. There were about 10 of us, home helps, in one area. And, we helped one another out and everything. So when I finished, it was really a blow, because I felt really worthless. So this is why I got involved in groups, so I belong to quite a few groups, you see. I mean, the NHS, really, because with being an older person myself, one of the biggest worries for me is ending up in hospital. It is a really big worry, or a care home. Not that I think I will, but it is a worry. And I think, we had at the time when I'm talking about when I was working, the NHS was in its glory then, because I had a very, there was nothing they could do for me. They just told me, I had a life-threatening condition. and there were nothing, only steroids and more steroids, and I was getting very bad side effects from that. But then I asked the consultant if there were anything at all that they could do for me, that, you know, like operation or anything, to stop having to take all these steroids. And he said, well, there is an operation, but it's only a 10%, you know, that you'd be all right. Anyway, I had a splenectomy after, and because of that, but, you know, that was because you could have time to talk to people then. You wouldn't be able to do things like that now and discuss, because they haven't time, have they? But, you know, the NHS were in its glory then. The cares, you know, care homes and everything. I did work in care homes for some time, and I worked in children's homes. They were all, you know, better in the 70s. But now, you know, it is, you know, it's unacceptable sometimes, I think. You know, the stories you read in care homes, and I think really training students, they're the future. You know, they're the next generation, aren't they, that are going to be in these jobs. And I think, you know, they should be aware, not like, not mention it, like a lot of it's shut up, isn't it, and they don't speak out about. But I think students should be aware of what's going on and how they're the future, and they, you know, are going to be the next, and get it back to how it was, you know, the NHS and social care.